Hello everyone, I am Julie Guhet, a nursing student. At gusto kong i-share yung case presentation namin regarding osteomyelitis. Ito ay isang requirements namin, kahit online, pwede pa rin gawin. Ito yung case ng pasyente namin. Pre-existing condition, left hip replacement 2 years ago, have septic shock with left hip osteomyelitis last year with subsequent removal of the hip replacement prosthesis and allergies to meperidine hydrochloride, morphine sulfate, and vancomycin hydrochloride. Our client profile is Mr. E is a 73-year-old man whose wife noticed a lump on his left hip that has increased in size over past 2 weeks. The skin around the lump is red and swollen. Mr. E complains of increasing discomfort in his left hip. His wife became concerned when he felt warm on his temperature was 38.30 degrees Celsius. So he brought him to hospital. Mr. E diagnosed with an abscess of his left hip and needle aspiration of the abscess reveals 30 cc of purulent exudate. Mr. E admitted for surgical incision and drainage of a suspected recurrence of osteomyelitis and for intravenous antibiotic therapy. A continuation of Mr. E case study. A surgical incision and drainage are performed to remove necrotic tissue, sequestrum, and surrounding granulation tissue. Bacterial infection is identified as Enterococcus fecalis. The nurse reviews the client's cardex and notes the dressing change prescribed is dry sterile dressing to the left hip daily with reinforcement as needed. The nurse medicates Mr. E with hydrocodone, acetaminophen, Vicodin 30 minutes prior to dressing change. While changing the hip dressing, the nurse notes there are 7 intact sutures along the incision line and hemovac drain is in place. Minimal drainage is noted at the incision site. The site is slightly swollen, but there are no signs of infection. The hemovac has drainage 30 cc of dark red blood. Mr. E tolerates the dressing change with minimal discomfort. He is febrile at 36.7 degrees Celsius. Medication prescribed to our client is solid, Fonda Parinox, Hydrocodone, and Acetaminophen, and Docusate sodium. So, let's go now to anatomy and physiology of our client case study. Let's us listen to our presentation. Thank you. Since wala kaming physical assessment sa pasyente namin, diretso tayo sa anatomy and physiology. Okay. So, our patient have lump on his hip. So, back to our anatomy, our pelvic bone is connected to our femur. And if you have a healthy hip, you can it can support your weight and allow you to move without pain. Next, Mika. So we know that our bone support the body structurally, protect our vital organs, and allow us to move. And our bone is made up of compact bone, spongy bone, and bone marrow. Compact bone makes the outer layer of the bone. Next, Mika. So, our compact bone is made up of peristeum. The peristeum is forms the outer surface of the bone, and the endosteum lines the medullary cavity, which the endosteum is found inside the bone that holds the bone marrow. Next po. So, Our structures of bone made up of compact bone forms the hard external layer of the bones and surrounds the medullary cavity or bone marrow. The function is to provide protection and strength of the bones. And the spongy bones or cancellous bone forms the inner layer of all bones, and the bone marrow is a soft gelatinous tissue that fills the medullary cavities, the center of bones. The two types of bone marrow are red bone marrow, known as myeloid tissue, and the yellow bone marrow or fatty tissue. Okay, next po. This is the illustration of compact bones. The compact bones consist of units called osteons or Haversian system. The Haversian, the Haversian canal contains the bones, blood vessel, and nerve fibers. Osteons in the compact bone tissue are aligned in the same direction along lines of stress and help the bone resist bending or fracturing. And our bone marrow is a spongy tissue inside some of bones in the body, including the hip and the thigh bones. Bone marrow contains of immature cells called stem cells. And the blood-forming stem cells in the red bone marrow are red blood cells. The function is to transport oxygen around the body, and the white blood cells help fight infection and disease. White blood cells include lymphocytes, the cornerstone of immune system, and the myeloid cells, which include granulocytes, neutrophils, monocytes, and eosinophils and basophils. And the last one is platelets, help the clotting after injury. Platelets are fragments of the cytoplasm of megakaryocytes, another bone marrow cells. Thank you.
Good afternoon to everyone. I'm going to present to you the pathophysiology of osteomyelitis. So let's begin with the predisposing factor. So in-include ko po dyan yung indwelling prosthetic device kasi nagkaroon po siya ng or history ng osteomyelitis 1 year ago. And then, second is the history of bloodstream infection. So, let's start with the open wounds. So, because meron po siyang galing po siya ng surgery po siya, nagkaroon ng open wounds. So, nagkaroon po ng entry yung bacteria. Bacteria gain entry by way of blood. And then, yung bacteria po, nag-lodge po siya and multiply sa may bone. And then, what happened next is, there is an inflammatory and immune response, which is, yung katawan natin nagre-release ng chemicals like histamine, bradykinin, and prostaglandin. Sila yung mga nagpo-promote ng inflammations. So, ang prostaglandins minsan, anti-inflammatory and inflammatory. Pero pag too much na kasi, nagiging harmful na po siya. So, these chemicals causes blood vessels to leak fluid into the tissues, causing swelling. So, nagkaroon na po siya ng acute inflammation, meron na po siyang edema and pus formation. And after that, infection travels to other segments of bone through the Haversian canal. Or Haversian canal contains the blood vessels and the nerve fibers. Also, it is infection travels to the other segments of bone through Haversian canals in the bone marrow. So, yung bone marrow po natin is a soft and gelatinous tissue. And stem cells. Ay, hindi ko pa pala nabanggit yung yung sa may inflammatory. Yung phagocytes pala, yung regarding sa phagocytes, kinocontain niya yung infection. And then, yung mga WBC natin, yung mga soldiers ng blood, kinakain niya po yung mga bacteria, harmful particles, mga ganun. Pero pagka masyado na pong marami kasi yung bacteria, pati na yung mga good cells is nakakain na rin po niya. So, yung infection po, nagta-travel siya and then infection reaches the other margin of the bone. And then after that, yung periosteum po, which is the membranous tissue that covers the surface of the bone is elevated. So, pag nag-elevate na po siya, yung blood supply is nabla-block. Kaya nagkakaroon po ng ischemia. Okay. Nagkaroon na ng ischemia. And then, after that, pag nagkaroon na po ng ischemia, syempre po yung mga tissues, wala na pong enough blood, nagkakaroon po ng necrosis o namamatay po yung mga tissues. And then after that, kung hindi po siya na-correct or yung treatment is partially successful, dito na po yung magre-recurrent yung osteomyelitis kung hindi po siya partially successful yung treatment. And regarding po sa may yung sa may case study natin, merong Enterococcus fecalis na bacteria na nakapasok, or ito kasing Enterococcus fecalis is bacteria found in feces. And itong bacteria po na ito, kasi nga po ang osteomyelitis is caused by Staphylococcus, pero ang na-found out po ng doktor meron siyang Enterococcus fecalis. Ito kasing bacteria po na ito, found in feces, pero it lives harmlessly in the intestine. But if it is spread to other parts of our body, it poses more serious infection. So, this bacteria can get into your blood, urine, or wound during surgery. So, ito po, yung kanina, ito po yung phase ng acute. So, yung next po na i-discuss ko yung kung paano siya naging chronic osteomyelitis wherein meron na siyang necrotic bone. Okay, so, after ng necrosis, magkakaroon ng formation of new bone, which is the involucrum. Ito po yung layer of new bone growth outside existing bone. So, yung nabanggit ko po kaninang periosteum kanina, very important po yan ng pagre-repair and growing bones. So, ang nangyayari po minsan kasi yung bones natin, di ba nagre-repair and nag-grow po siya. So, ito, yung nangyari po, nagkaroon ng formation ng new bone. Yun po yung involucrum, o yung, para siyang nanganak, parang gano'n, nagkaroon ng bukol. Kaya po, yung pasyente natin is meron siyang lump. Ayun. And then, kasabay po niya, nagkaroon ng separation of the vitalized bone from living bone. So, when we say devitalized, yung necrotic yun, or which we call the sequestra. Yung sequestra po is a bone fragment surrounded by pus and granulation tissue. Kaya, meron po siyang abscess. Nagkaroon po ng abscess yung pasyente po natin. And then, continues to be
Okay, sometimes sequestra is, hello.
Yes, ma'am.
Sometimes
Yes, ma'am.
sequestra is called as dead bone tissue. While
Yes, ma'am.
involucrum, yung patay na bones, no? Ay yun yung bulok, bulok na buto, tapos bigla siyang tinubuan ng bagong buto.
Yes, ma'am.
Doon sa
Para
involucrum.
siyang
Kaya
nanganak.
bulok. Ginamit yung bulok kasi bulok, no? From involucrum, yung bulok na buto, tumubo na bagong buto. Okay? Sa
Yes,
sequestra
yes.
naman, dead bone tissue siya. Yan.
Yes, ma'am.
Para mas
Opo.
madali, no? Okay, sige, continue.
And then, continues to be an infected island. And then, nagkaroon po ng, yung blood-borne antibiotics po nagkaroon ng difficulty to reach the blood. So, nagkaroon ng enlarged sequestrum. Dumami po yung sinasabi ni ma'am na dead bone tissue. And then after that, nagkaroon po ng development of sinus tract. So yan na po yung sa may chronic. Ito na po yung ano niya, yung sa may chronic stage po siya. Wherein yung sinus tract po is at tunneling wound. Hello? Ay, narinig niyo pa ba? Ayun. Okay. So, yung
Oo.
sinus tract po, a narrow opening extending from wound underneath the skin in any direction through soft tissue result in dead space for abscess formation. Yun lang po, ma'am. Kaya meron po siyang abscess.
Yes, okay, sige, continue. Mamaya na ako mag-question and comment, no, mamaya.
Yes,
Dinagdag ko
ma'am.
lang yun
Thank you
kasi baka
po.
makalimutan ko yung situation at saka yung introduction. Okay.
Yes,
Let
ma'am.
us continue to
Sorry.
the next hanggang matapos. Doon ako mag-comment.
Diagnostic na ba?
Hindi ko alam siya ano ba? Diagnostic na ba?
Yes po.
Oo.
Ay, La-Arnie. Yung sa atin. Shen.
Oh,
Shen. Yung kay
yes.
La-Arnie kasi na-submit ba niya La-Arnie yung ano?
Hindi.
Hindi. Yung sa'yo lang
I-ano
to. Ano?
na
Alis
lang.
muna ako?
Ano mo
Sige.
na lang to? Yung kay La-Arnie na lang.
Sige. Tinanggal ko na.
Meron na. Sa diagnostic test po, they have they perform the test, CBC, complete blood count. And as we can see, the result po ng WBC niya, yung white blood cells is elevated. And the neutrophils, elevated po din siya, kaya nagkaroon ng septic shock kasi meron po siyang infection. So, kinailangan pong i-x-ray. So, ayan po yung yung normal hip value. Yan yung normal hip image po ng leg. And then sa x-ray po, it reveals na meron siyang konting problema. Meron po siyang parang dislocated na po siya. So, kailangan po na sumailalim po siya ng MRI para makita po yung full view ng hip niya. So, sa MRI po, nakita po na nagkaroon na po siya ng abscess, edema, sa may bone marrow. So, kinailangan po nilang tanggalin. So, yun yung yun yung prosthesis po. So, kailangan nilang mag-perform ng biopsy. And sa biopsy po, kailangan din ng incision and ito yung blood culture po para po ma-sure and the exact location po and ma-sure yung diagnosis kung talaga pong ano siya dito, osteomyelitis. So, yung blood culture yung blood culture result po ay positive siya. So, kailangan po nila ng bone cultures from biopsy or aspiration to have a para po ma-check. And then, yung laboratory results test, i-explain na po ni Madam Julie. Thank you. Julie. Ay, Tessie.
Sige.
Test.
Po, good afternoon.
Test.
Test yung
Sa amin
sinend mo
po,
sa akin or yung ano?
yun na lang yung pag-alarming.
Yung sa
Yung
kanya na
about
lang?
sa laboratory test po, upon admission of Mr. E, nagkaroon po siya ng, may order po ng doktor na magkaroon siya ng laboratory for hematology. And uh, result po ng uh, hematology si Mr. E ay makikita po natin na may elevated po dun sa blood cell na neutrophil. Nagkaroon po siya ng elevated kasi uh, uh, nagkaroon elevated kasi dahil sa infection causing bacteria and multiply in the blood, and the bone marrow produces more white blood cells in order to fight off the infection. And another, the infection to inflammation, which can cause the number of uh, cells to increase. And uh, nagkakaroon din po siya ng elevated sa white blood cell count kasi it may indicate that the immune system is working to destroy the infection. Neutrophils po, nagkakaroon din po siya ng elevated dahil po sa high percentage of neutrophils in the blood. That is called the neutrophilia. And it also the body has an infection. Neutrophilia can point to a number of uh, including the infection that is more likely on the bacterial. And then for the uh, result po ng pasyente na si Mr. E ay meron po pa rin siyang ang tawag nito, may slight pa din na elevated dun sa WBC niya. Dun po sa dun po sa neutrophils niya, nag-decrease po yung sa result niya. Kasi nagkaroon po siya ng sa situation nagkaroon po siya ng drainage, hemovac drain sa nag-decrease po yung sa WBC niya. Then sa po. Then sa third na CBC ni hematology po ni Mr. E ay normal po yung result ng kanyang WBC at saka yung sa neutrophils po. Lang po.
So, the last po na laboratory result po niya, normal naman na po. So, pwede po nilang i-perform yung surgical incision kasi okay naman po yung na-cure na yung infection. So, yun lang po. Thank you. Next.
NCP na ba?
Yung diagnostic, hindi pa tapos.
NCP na ate.
Wait lang ha. Buksan ko lang yung sa amin. Dito slides. Ay. Ano nangyari? Ayoko. Mamaya magpa-present muna ako. Wait lang. Monix?
Okay, sige. Nursing care plan for osteomyelitis, acute pain. Assessment. Under subjective. Atoy sa as verbalized by the patient. Pain scale of 8 out of 10. Reports of a decreased ability to perform ED because of discomfort. Objective. Blood pressure of 130/80. Respiratory rate of 26. Pulse rate of 110 beats per minute. Pain is located on the left leg. Throbbing pain. Slight swelling in the affected area. Warm feeling in the area. Facial grimaces. Irritability. Protective guarded behavior. Another one is restlessness. Another evidence is refusal or inability to participate in ongoing exercise. Spasm. Feeling of spasm, tingling, numbness, withdrawal, and restlessness. Diagnosis, acute pain. Planning. After 20 to 30 minutes, client will report satisfactory pain control at a level less than from the level of 8 to 6, from pain scale of 8 to 6. Client will use pharmacological and non-pharmacological pain relief strategies. Client will exhibit increased comfort such as baseline levels for heart rate, blood pressure, respiration, and relaxed muscle tone or body posture will decrease to normal level. Client will engage in desired activities without an increase in pain level. Intervention, nursing intervention, independent. First, I elevate the legs. The rationale for elevating the legs is to reduce swelling in the area affected. Second, assess the client's description of pain to know the extent of pain. Third, handle extremity with great care and gentleness. The rationale for it is the wound itself is very painful and must be handled carefully. Fourth, immobilize the area with a splint to reduce pain and muscle spasms. Fifth, apply a hot or pack. Heat reduces pain through improved blood flow to the area and through the reduction of pain reflexes. Six, quiet and calm environment to reduce
Ay, sorry.
stress, thus promoting relaxation. Next natin.
7.
7. Encourage patient perform focused breathing. The rationale behind this is a relaxation exercise that can alleviate pain. Encourage diversional activities. This is helpful for patient to be distracted from pain. Number 9, patient good body mechanics. To minimize pain in daily activities is the rationale. Number 10, encourage patient to rest to prevent fatigue. Number 11, discuss with significant others ways in which they can assist client to reduce precipitating factors that may aggravate pain. To, to gain to gain cooperation and care of patient. Dependent intervention. Administer analgesics as prescribed by the physician. Provide fast relief of pain. Evaluation. Evaluation after 20 to 30 minutes, client able to report satisfactory pain control at a level of 8 to 6. Goal met. Client was able to use pharmacological and non-pharmacological pain relief strategies. Goal met. After 20-30 minutes, client will exhibit increased comfort such as baseline level for increased relaxed muscle tone or body posture. The client's BP decreases from 130 to 80 to 110 to 60, RR of 26 to 20, and pulse rate of 110 beats per minute to 100 beats per minute. Goal met. Client was not able to engage in desired activities without an increase in pain level. Goal not met.
Okay na, Monix? Impaired skin integrity. Naririnig niyo ba ako? Hello? Hello?
Yes, malinaw.
Okay.
Yes, continue.
Ayan, impaired skin integrity. Subjective, okay, wala kaming subjective. I will proceed with the objective. Affected area, tender to touch. Damaged or destroyed tissue. Local pain, protectiveness towards sight, and then skin and tissue color changes, and close and open parenthesis, the color is red. Diagnosed cyst is impaired skin integrity. Okay, planning. After 20 to 30 minutes of nursing intervention, the patient reports any altered sensation or pain at the site of tissue impairment. Patient will demonstrate understanding of the plan to heal the tissue and to prevent injury. Patient describe measures to protect and heal the tissue, including wound care. We will proceed with the intervention in the independent. Assess site of impaired tissue integrity and its condition. Redness, swelling, pain. The rationale for all of this is for the indication of inflammation of our body. Assess characteristic of the wound, including color, size, drainage, and odor. This to give us more information on the extent of the tissue integrity. No signs of itching and scratching. The patient who scratches the skin is to attempt to alleviate the extreme of itching and may open skin lesion and increase risk for infection. Assess patient nutritional status. If there is an adequate nutrition intake, that intake places the patient at risk for skin breakdown and compromises healing. Evaluation. After 20 to 30 minutes of nursing intervention, the patient was able to report any altered sensation or pain at site of tissue impairment. Patient was able to demonstrate understanding of plan to heal tissue and prevent injury. Patient was able to describe the measure to protect and heal the tissue, including wound care. After 8 hours of nursing intervention, the patient would not decrease the size. The patient would wound did not increase in size and has increased granulation tissue and go not met. Roxanne?
Ate, sinabi niya wala daw siyang naririnig.
Ay,
Baka
diretso
pwede,
ko.
Hello?
ay, taga-dinig.
Hello?
Opo.
Hello?
Sino magpe-present?
Hello.
Roxanne?
Roxanne,
Chacon? Roxanne?
Sige na, ate, okay na. Naglolo ko kasi.
Wait lang, wait lang.
Sorry.
Wait lang. Stop ko lang kasi share ko
Sige,
ulit,
ate.
ah.
Sige, ate.
Nawala yung, saan na yun? Profile. Wait lang, ah. I-open ko lang ulit.
Next is impaired physical mobility. Hello. Okay na, ate?
Nakita mo? Nakikita mo?
Ate Shane.
Roxanne, nakikita mo?
Ate. Rinig.
Oo, naririnig ka namin.
Nakikita namin din.
Under subjective, nahihirapan ako sa paggalaw-galaw as verbalized by the patient. Objective, restlessness, guarding behavior, and use of immobilization devices as manifest by with reluctance to movements, limited range of motion, decreased muscle strength or control, inability to move purposefully within the physical environment, imposed restrictions, verbalization of nahihirapan ako sa paggalaw-galaw. Planning, after 2 to 3 days of providing appropriate nursing intervention, the patient will have an improved adaptation to condition and will experience ease in physical mobility. Nursing intervention, assist client reposition self on a regular schedule as indicated by individual situation. Rationale, to avoid pressure ulcers. Second, instruct use of side rails and overhead trapeze for position changes or transfers. Rationale, for safety and ease of movement. Assess degree of immobility produced by pain. The rationale is level of activity or exercise depends on progression or resolution on inflammatory process. Instruct patient in or assist with active or passive range of motion exercises of affected and unaffected. The rationale is increases blood flow to muscles and bone to improve muscle tone, maintain joint mobility. Encourage patient to maintain upright and erect posture when sitting, standing, and walking. Rationale maximizes joint function and maintains mobility. Evaluation after 2 to 3 days of providing appropriate nursing intervention, The patient will have a diminished risk to acquire peripheral neurovascular dysfunction.
Assessment. Assessment for risk for infection objective. It is evidenced by client undergoing a surgical procedure and may be exposed to environmental pathogens, history of infection, diagnosis, risk for infection, planning. After 20 to 30 minutes of nursing intervention, the patient will identify individual risk factors and interventions to reduce potential in for infection. Maintain safe aseptic environment. Intervention. Independent. Adhere to facility infection control, sterilization, and aseptic policies and procedures. Verify that pre-operative skin and bowel cleansing procedures have been done as needed depending on specific prepare operative site. Establish mechanism rationale for adhering to facility infection. Establish mechanisms designed to prevent infection. Rationale for verifying cleansing reduces bacterial counts on the skin. Ay, ba't meron ba? And alimentary tract. Minimize bacterial counts at operative site. After 20 to 30 minutes of nursing, meron pa. Examine skin for breaks or irritations, signs of infection. The rationale for this is the disruption of skin integrity at or near the operative site, sources of contamination to the wound. Fifth, maintain dependent gravity drainage of indwell catheter tubes, positive pressure of parenteral irrigation, prevent stasis and reflux of fluid. Identify breaks in aseptic technique and resolve immediately on occurrence. The rationale for this is contamination by environmental or personal contact renders the sterile field unsterile. Apply sterile dressing, prevents environmental contamination of fresh wound. Provide copious wound irrigation. Use postoperatively to reduce bacterial count and cleanse the wound debris. Dependent. Administer antibiotics as prescribed by the doctor. May be given prophylactically for suspected infection or contamination. Evaluation. After 20 to 30 minutes of nursing intervention, the patient was able to identify individual risk factors and interventions to reduce potential for infection goal met. After 20 to 30 minutes of nursing intervention, the patient was able to the nurse was able to maintain safe aseptic environment.
Hello.
Hi, ma'am.
Hello.
Last, fatigue.
Dito po.
Assessment under subjective. Kasla lang naman banung kanayong activity lang as verbalized by the client. Fatigue, drowsy, listless, lethargic, decreased performance, compromised concentration, and disinterest in surroundings. Nursing diagnosis, fatigue. Planning, Short term, after 6 to 8 hours, the client will report improved sense of energy. Long term, after 1 to 2 days, the client will be able to perform ADLs and participate in desired activities at level of ability. Intervention. Have have patient rate fatigue and the time of the day when he experiences fatigue most. Rationale, it helps in developing a plan to manage fatigue. Second, plan care to allow for rest periods. Schedule activities for periods when patient has the most energy. Rationale, frequent rest periods are needed to restore and conserve energy. Planning will allow client to be active during times when energy level is high. Third, assist with self-care needs. Assist with ambulation. Fourth, keep bed in low position. Rationale. Patient is at risk for injury because of low energy. Fifth, encourage patient to do self-grooming. Rationale. Weakness may make ADLs difficult to complete. Six, monitor physiological response to activity, changes in BP, pulse, and respiratory rate. Rationale, tolerance differ vary greatly depending on the stage of disease process, nutrition, fluid balance, and reaction to therapeutic regimen. Lastly, perform pain assessment and management of pain. Rationale, poorly managed pain can result to fatigue. Evaluation. After 6 to 8 hours, the client was able to report improved sense of energy. Goal met. Long term. After 1 to 2 days, the client was able to perform ADLs and participate in desired activities at level of ability. Goal met.
Yun lang.
Hello? Naririnig po?
Yes. Yes, Mika.
Opo. Lastly, we have the drug study. There are five medications given to the patient, which are linezolid, Fonda Parinox, Hydrocodone bitartrate Acetaminophen, Docusate sodium, and Acetaminophen. First, we have the linezolid. Brand used was by Zyvox. Classification is anti-ineffective, administered intravenously with a dosage of 600 milligrams every 12 hours. It is a treatment of infections caused by vancomycin-resistant Enterococcus faecium. It inhibits bacterial protein synthesis at the level of the 23S ribosome of the 50S subunit. Side effects are headache, diarrhea, nausea, taste alteration, vomiting, thrombocytopenia, and optic neuropathy. Nursing considerations, we have to monitor vital signs, monitor for signs and symptoms of bleeding, hypertension, or pseudomembranous colitis that begins with diarrhea. Monitor bowel function and avoid foods and beverages high in tyramine. Next, we have Fonda Parinox. Brand used was Arixtra. It is an anticoagulant administered subcutaneously with a dosage of 2.5 milligrams. It is a prevention and treatment of deep vein thrombosis and pulmonary embolism. The action is interruption of the coagulation cascade, resulting in inhibition of thrombus formation. Prevention of thrombus formation decreases the risk of pulmonary emboli. Side effects are dizziness, constipation, diarrhea, dyspepsia, nausea, vomiting, hematoma, rash, bleeding, thrombocytopenia, fever, and increased bone drainage. Nursing considerations, we have to assess for signs of bleeding and hemorrhage, monitor and report unusual muscle weakness, aches, or cramps that might indicate hypokalemic. Monitor any wounds or suture lines for increased drainage or bleeding. And advise patient to report any symptoms of unusual bleeding or bruising, dizziness, itching, rash, fever, swelling, or difficulty in breathing. Next, we have hydrocodone bitartrate and acetaminophen. Brand used is the Vicodin. It is for allergy, cold, and cough remedies and opioid analgesics. Administered orally with the dosage of 500 milligram hydrocodone and 300 milligram acetaminophen. It is used mainly in combination with non-opioid analgesics in the management of moderate to severe pain. It binds to opiate receptors in the CNS, alter the perception of and response to painful stimuli while producing generalized CNS depression. Side effects are dizziness, sedation, euphoria, hallucination, headache, blurred vision, respiratory depression, hypotension, bradycardia, constipation, dyspepsia, nausea, and vomiting. Nursing considerations, we have to monitor vital signs, use appropriate pain scales to document whether this drug is successful in helping managing the patient's pain, and advise patient to take medication as directed and instructed. Next, we have acetaminophen. Brand used was Tylenol. It is an analgesic and administered orally with the dosage of 500 milligrams every 4 to 6 hours. It is for mild pain and fever. It inhibits the synthesis of prostaglandins that may serve as mediators of pain and fever. Side effects are nausea, stomach pain, loss of appetite, itching, rash, headache, dark urine, clay-colored stools, and the nursing considerations are do not exceed the recommended dosage, give drug with food if GI upset occurs, do not exceed recommended dose, and report rash, unusual bleeding or bruising, yellowing of skin or eyes, and changes in voiding patterns. Lastly, we have Docusate sodium. Brand used was Colace. It is a laxative, orally administered with a dosage of 400 milligrams. It is a prevention of constipation used as enema to soften fecal impaction. It promotes incorporation of water stool, resulting in softer fecal mass. Side effects are abdominal cramping, stomach pain, diarrhea, excessive bowel activity, intestinal obstruction, throat irritation, rash, low electrolyte levels, and dependence. Nursing considerations is you have to assess for abdominal distension, presence of bowel sounds, and usual pattern on bowel function. And we have to assess color, consistency, and amount of stool produced. Yun lang po.
Tapos na yon.
Yes, ma'am.
Opo.
So, wala na siyang kasunod. Usually, diba, sa huli yung NCT, bakit sa huli yung drug study?
Nagkamali lang ma'am ng order.
Okay, so Number one, since your case is osteomyelitis, no? So there are lots of bacteria or organisms that may cause infections, no, in that area. So the findings reveals that it is the Enterococcus faecalis, di ba? The E. faecalis.
Opo.
Okay, para saan yung E. faecalis? Saan yan?
Sa may
Ah?
thesis po.
That is usually found in the
Thesis po.
feces, yes.
Opo.
And what happens? What do you think happens to the patient? Bakit siya nagkaroon ng infection na E.
Ma'am, baka poor
faecalis?
hygiene po.
Poor hygiene, no? Saan siya nag-poor hygiene?
Sa toileting? Or sa ginagamit?
Poor personal
Kaya,
hygiene means that the patient didn't properly wash his butt, no, during
yes, ma'am.
and then or the other way around na the patients didn't wash his hands before after using the toilet or the bathroom, di ba?
Opo.
Okay, so saan ba yan, paano na-acquire ng pasyente yung epicalis bukod dun sa, dahil nga hindi siya nagpugas ng kamay, no, hindi siya properly hygienic, so paano na ngayon nakapasok yung epicalis, no? So remember that the most common bacteria found in osteomyelitis is Staphylococcus aureus.
Yes, ma'am.
Ang bihira lang yung fecalis. So paano nakarating yung fecalis dun sa kanyang infection?
Ma'am, through yung blood po niya, ma'am. Yung sa blood. Kasi sabi naman po yung ma'am, kasi sabi naman po niya dun sa may nabasa ko is yung Enterococcus fecalis po, nagre-reside po siya sa intestine harmlessly. Pero pag nag-spread po siya sa other parts ng body, nagpo-cause po siya ng infection, ma'am. And it can get into your blood, sabi po niya, ma'am. Or wound during surgery.
Okay. So, second one, okay, thank you doon sa typically. So, nakuha yan dahil nga sa sumasama siya sa pagkain, no? Pag hindi nagugas ng kamay na ayos, tapos kumain, o kaya naihawak sa ibang mga lugar-lugar, no? Parang COVID, no? Na madumi yung kamay, hinawak sa doorknob, no? Yung nasa doorknob, may kumawak na iba. Tapos kumain, hindi nagugas ng kamay bago kumain. No? So yan, pwede niya makuha yan, pwede ma-acquire. No, next is that yung consistency ng inyong assessment. Bakit gumagamit minsan ng Mr. E, Mr. B?
For privacy purposes.
For privacy
Purposes.
Pero bakit hindi siya consistent when you use Mr. E? Mr. E lang hanggang matapos. Bakit may Mr. B? Dun sa presentation niya, I'm talking about the presentation.
Sorry ma'am, di po na-edit.
Hindi na-edit. So, sino talaga yung pasyente na yun? Wait lang. Okay, next is with regards to skin turgor, anong findings? Bakit skin turgor tapos ang findings skin turgor din? Nakita ko kanina. Anong dapat ng findings sa skin turgor? What will you look or assess to the skin?
Ipa-paraphrase lang ko sana yan kanina. It should be...
Hello, ma'am.
Hello?
Hello po.
Hello, yes. Oo. Dapat ano?
Hello, ma'am?
Dapat ano?
Yung skin turgor niya po, poor na po siya, ma'am. Yung skin turgor niya.
Sagi. Hello?
Hello, sino ba sumasagot sa inyong tatlo? Miss Hermosa? Hermoso? Hello?
Ma'am, yung skin turgor, hello? Hello?
Hello, yes, sige,
Hello?
diretso lang.
Ma'am, kasi yung skin turgor niya is, gawa ng sagi na siya and matanda na siya. So, ipaparaphrase lang po sana yun. It loses the elasticity na ma'am sa ano niya, sa findings niya, assess findings. And then sa analysis niya, due to aging, paraphrase po namin.
Oo. Tapos, dapat ano nga, skin turgor na makita. Ano i-check pagka skin turgor? Bakit mag-check ng skin turgor? Para saan yun?
Yung time po, ng pagbabalik nung pag pininch mo.
Yung di ba kasi pag pininch po yung pag-old na is hindi na ganun ka-elastic, ma'am, yung kanyang skin.
Elasticity.
So, elasticity po,
Dahil ba
naglulus
yun sa old age? Dahil ba sa age yun? Bakit tayo we all know that
check din yung yung kung dehydrated ba yung patient or hindi.
Yes, ma'am.
Yes, that is to check if the patient is dehydrated. Kapag pininch mo yung skin niya, no, para makita mo yung skin turgor, babalik ba siya kaagad, no?
Kaagad, oo.
Pag hindi, baka dehydrated yung pasyente. No? Kung sa bata yan, sa ulo, no, pag lubog yung ulo, ibig sabihin, nagugutom, uhaw, dehydrated ang bata. So, sa balat, sa may edad na, so titingnan mo ang skin turgor, ipipinch mo kung siya ay babalik ba kaagad or matagal siyang bumalik kasi baka dehydrated yung pasyente. Okay?
Yes po. Yes,
okay.
Thank you po.
Why is it that before changing the dressing, no, before wound dressing, before changing of the wound, bakit pinainom ng Vicodin yung pasyente? Sabi dun sa history, the patient was given Vicodin 30 minutes prior to dressing change. Why?
For pain, ma'am.
Pain, bakit nga?
To lessen the pain.
Bakit kailangan bigyan ng Vicodin yung pasyente bago mag-change ng dressing?
To ease the pain.
To lessen the pain. Hindi, you have to lessen. At least hindi niya maramdaman masyado na masakit yung pag nililinis yung sugat niya, no? So, kasi since it is osteomyelitis, medyo malalim yung sugat na yun, no?